Good day. My name is Sean Fry. I'm the CEO of Prevalent Health, and I'll be your host for the duration of this initial training of how to register and begin using your cases as you transition from a student into the active workforce. The first thing you need to do is go to the website training.prevalenthealth.com, and you will see a log on, and the first thing we need you to do is click join. Once you click join, you'll be able to create your own username and password. It's very simple stuff. Go ahead and do that and click save. It will generate an email to our admin who will begin to assign you cases. Just go ahead and do that right at the end of this video, or you can click stop right now and go and do that, and we'll try to get you logged in as soon as we can today. Once you're done, you can go back to the main website and click log in and use your active account, and what you will see is a version of the Prevalent Health system. Prevalent Health is capable of operating anything from a small physician's office to a medical clinic to a ambulatory surgery center to a hospital outpatient department, all the way up to an acute care hospital. Prevalent has all the tools that you'll be using in the real world, so feel free to explore. There's many things in here that you cannot hurt anybody by trying them. Become familiar with the terminology. These are things you're going to be expected to know as you join the workforce. But for the purposes of this training, go under Patients, and you will see the cases under My Cases, the cases that are assigned to you. Once you click My Cases, you will see a list of patients of different types: emergency, lab, outpatient, even as complex as ambulatory surgery and inpatient. Don't worry, we're not going to ask you to do inpatient first day. We're going to start out doing very basic physician services, but I want you to know there are literally hundreds of thousands of cases in here of different types for you to hone your skills, so when you get to a job interview, when you get put into meaningful employment opportunities, you are not overwhelmed. You can try the skills and the knowledge that you've invested through your program at UMA, or in your own self-teaching. You'll have a forum here by which to test your own skills. Cases will come in one of two types. They'll typically say assigned to case. You can check out the chief complaint of each case type. Here, this is let's go in here. One of the first things you can do is look at the actual medical record of the patient. This will come in on either a TIFF or a PDF file. You go in here and you can zoom in, and you can see the things that are on about the patient. All PHI is covered, so you can just skip around and see that this patient was admitted with strep throat. When you go into the case, you can open the medical record or open the case, and you will be able to see all the different functions you would see in a hospital: vital signs, medical problems. Pay no attention to this right now, but feel free to explore and become familiar with the issues, and you will be able to go right into the case. What you will be assigned now that you have the medical record is to go in here and verify all the services performed to this patient. Here you see she's a 20-year-old female, and her name Johansson. This is not Scarlett, I promise. And see what was happening here. This is an ER level 2 triage level 4 visit. She was provided certain drugs, did a urine specimen, ibuprofen, the actual prices, and this is the information that you will need to understand and know how to apply, which we believe that you already have this knowledge. And here it is in a format in which you can actually work on this case. There will be issues with this case, and you will get hints with each case as to what is wrong. These hints will come up and say this patient has no diagnostic code, the occurrence code 11 is missing, onset of symptoms, primary diagnosis code is missing, and attending physician is not found. It is your responsibility to go back to the medical record or whatever documents are provided to you and fill in those blanks so this case can be coded correctly. The other section you will have access to, you can have access to all sections that are critical, is under coding. The ICD-9 diagnostic codes, and this is where you can go in and find the diagnostic code for strep throat. And this will tell you, and here's strep sore throat. It automatically populates the diagnostic code. You code type, this would be the admitting diagnosis and possibly the final diagnosis. These will be your responsibilities. You pick here the date that you coded it, and once you've completed coding this, if this is all the information that's needed, you can click Final Coding and Save. If additional information is needed, please document the absent information. All those types are sent here: signed face sheet, pending MRI report, whatever is absent should it be. Click Save. Then you can go in here and look at the procedure codes that were performed, go back to the services, add the procedure codes as needed, and you will be able to complete this claim. Prevalent has 3M built in. It is turned off currently during this initial phase, but eventually you will be able to use advanced tools such as McKesson, 3M coding and billing reimbursement. These are reimbursement tool. You will be exposed to these in the workforce. You will be exposed to these later after this initial phase once we go through this training, but you will not have to be responsible for knowing how to navigate 3M or McKesson in this initial phase. Just use your core knowledge as you see fit. Once this case is complete, you can go back to the main menu, go back to your cases. You can go back to your cases at any time, actually. And once you've completed, click Ready to be Tested, and you can move on to your next case. Next case would be a lab. Complete the same process. Look at the medical record, and again, you'll have a various series of alerts. But feel free to navigate around and see medical problems, tachycardia unspecified, vitals if they're available, all the medical records. Feel free to look in and around each and every place. Once you've completed these cases, we're not going to give you too much information. We want to see what you know, what you don't know. There will always be a help desk if you run into a situation and you're not quite sure what to do. You may open this thing up, add a request, select the patient which you're working on, enter your request. I am not sure. Please, information is missing. However you wish to communicate, communication is critical in a hospital setting. We want to see how you communicate. If you can ask questions that are we can use. This is not a complaint forum, but if you do see something and you have a suggestion, this is an adequate way of making that happen. Click Submit, and you should expect an answer within either within 3 hours or within 24 hours, depending on the complexity of your question. Your messages will all populate back through here, and you can send messages in and amongst yourselves. New message, and this is a communication format to other people in the system, such as me, and all of you people will be in there. And if you want to ask a question, you can ask the question on a chart note, add the medical record number, and you can enter an internal message, and you will get messages periodically about reviewing something or a modification to a system, and this message system will help you navigate the system. So feel free to look at these. We've taken off most of the reporting. There's plenty of other information in here. We ask you to explore it. Once you get back to this case, once you want to look up a patient, you can always look them up this way. And here are the patients that are in the system. The same patient was imported 3 times, but you can find them by name, date of birth, medical record number. You should be able to navigate in and out of a healthcare system fairly adequately. Go ahead and go make some mistakes. This is a great opportunity for you to apply your skills in a real system. Let's find out what you know, what you don't know. Feel free to go back to whatever means or however you learn to accomplish this knowledge, but we want you to try to do it on your own. It's critical that you try to this is exactly the experience you would get in an office. You would get minimal training. We need to find out what you know, and we will train, because training is very expensive on a hospital's budget, and you're taking our best people away from their desired tasks, which is why people who complete this program on their own are going to get the best opportunities of those that are available, because they will be immediately employable, because we know they're self-motivated, self-taught, and would be great assets to that company. So that said, thank you very much for paying attention, and best of luck to all of you.